We're going to look at the concepts of holistic nursing, and then we're going to look at a few of the different nursing models, which you'll go, oh yeah, I remember that, and that's what my students are talking about. But I think it's important for us to just, I won't dwell on it too much, but look at the origins of the different models of nursing available to us and which ones I think we would be better using and how they work for us. We're going to look at the concept of evidence-based practice. So that's what I was explaining. If you want to do some change, often you need the evidence to support that change. Otherwise, why are you changing it in the first place? Yeah, we're just changing for change's sake. We'll look at nursing process, how these different models of nursing can have an impact on the nursing care that we give our patients, and also how we can make them work in our own individual practice. And I can guarantee now we don't do care plans all the time where I work, but in the more critical patients where we do it, I always flag something up I forgot. It always makes me think about something I didn't think about if I was just looking at the patient by doing my OBS. Okay, so I do think they're important. So none of you are using them outside of VN training. And how do you fill your students with confidence, enthusiasm and excitement about the nursing care plan? Or are we all a bit, oh yeah, we've got to do nursing care plans soon, if you finish training you don't have to do them anymore? Which really has quite a negative impact when we've just started. Yeah, and I think we should sell it a bit better. We're not going to do that big full-on thing that we do for the training, but it is something actually we should take quite seriously and say to them, you know, it seems quite a big task at the moment, but actually once we get this streamlined, it's really going to improve your nursing skills. It's a great tool for us to use in practice. It has a positive impact on the way that we're able to nurse our patients. It helps raise the standard of care that we provide. It allows us to focus on holistic nursing, and it should benefit the patient, the owner and us. I think it actually becomes quite rewarding when we look at the patient in maybe a slightly different way. So holistic nursing is a philosophy of nursing that takes into account total patient care. So we consider their physical, emotional, social, economic and spiritual needs, and their response to their illness, the effects of the illness and the patient's ability to meet self-care. This obviously comes from the human side, but I think we know actually that the mental impact on illness to us, or if we've had an illness that stopped us doing something we really like to do, it can actually make the recovery from that illness harder. Would you agree? So for a patient being separated from their owner, maybe they live with an elderly lady in a quiet flat, and now they're in this hospital with a hustle and bustle and a beep and the noise and they're not sleeping. All of this stuff makes it much harder for them to get through maybe the perception of pain, the lack of sleep, all of these kinds of things. So Florence Nightingale was the pioneer for human holistic nursing, and she was the first person to actually develop the concept, and she believed that a person's well-being could be affected by what was going on around them. She felt there wasn't enough focus on, she felt there was too much focus on the patient's medical problem from the doctors, and that nurses need to implement nursing care to actually optimise that patient's health and well-being. So for us to be holistic nurses, we need to see more than just the patient's injury. And I think when you become a nurse, that is what happens. You see more than the patient's injury. Look at the patient's individual setup, what they're used to at home. You need to find out as much as possible about that patient's normal lifestyle.